I'm Brian Pierce. I'm the Vice President of Clinical Services and Provider Management at MedRisk. I'm a physical therapist, and this is your Clinical Minute. So let's talk a bit today about some of the differences between a physical therapist and an occupational therapist. These are two rehab disciplines that are really closely connected. Very similar training, very similar licensing standards. They work in a lot of the same settings, handling a lot of the same types of patients. The biggest difference between the two is their approach to recovery. So a physical therapist tends to be more oriented towards restoring movement. An occupational therapist tends to be more oriented towards restoring function. Physical therapists might focus on teaching someone to get themselves out of bed, helping them learn to walk again, getting their arms and their legs moving again. An occupational therapist might look at the same patient and focus on helping them dress themselves again, learning to feed themselves again, helping them live independently. Now, if we shift to the outpatient environment, generally speaking, most musculoskeletal referrals find themselves in physical therapy. But there is a good bit of crossover between the two disciplines in the area of the elbow, the wrist, and the hand. So because this part of the body is so closely connected to restoring function, occupational therapists are called upon a lot in this area. And depending on the part of the country, the type of practice, or the diagnosis, you might see more occupational therapy referrals for this part of the body than physical therapy referrals. A lot of the referrals in the elbow, wrist, and hand find their way to hand therapists. So a certified hand therapist would be a therapist that's a PT or an OT that's gone on for additional certification and has an expertise in addressing some of the more complicated issues in the upper extremity.